you ever stopped to consider the relationship between fear and trust? The more fearful someone is, for whatever reason, the more it tests one's trust in something or someone else. During the COVID-19 pandemic, the complicated relationship between trust and fear became not only evident, but very difficult to manage. In this video, I take a look at JAMA's Open Network article entitled Trust in Physicians and Hospitals During the COVID-19 Pandemic in a 50-State Survey of U.S. Adults, published July 31st, 2024. This article exemplifies the challenges of political issues leaking into medical and public health research and science. My intent is to avoid the political issues because politics has no role in understanding disease. Politics and social issues fall in the effects of disease and dealing with the effects of disease, not the disease itself. As I read this, I really sense a fear of disease. When we paint fear of disease in terms of people's trust in a system, it turns the problem into a political issue rather than the medical and natural one that it is or was. A key limitation here is the authors did not consider the role of fear. That oversight limits the application of the findings. Without further ado, let's see what they have to say. Be sure to stop by ZazariProject.com for the latest discussion. Here's the reference article posted on JAMA Network Open. For those unfamiliar with the Journal of the American Medical Association, the association was founded in 1847 with a mission to promote the art and science of medicine and the betterment of public health. They identify as representing physicians with a unified voice in courts and legislative bodies across the nation, removing obstacles that interfere with patient care, leading the charge to prevent chronic disease and confront public health crises, and driving the future of medicine to tackle the biggest challenges in healthcare and training the leaders of tomorrow. Let's see if this article, published in their journal, supports these criteria noted in their mission. Since context is everything, let's look at the authors. The first author, Roy Perlis, works in quantitative health, is a physician in psychiatry, and is an associate editor for this publication. According to the Broad Institute website, he has an MD from Harvard Medical School, a Master of Science in Biostatistics, and completed residency and chief residency at Mass General. The second author, Catherine Ogniova, is an associate professor of communication who studies the effects of social influence on civic and political behavior, confidence in institutions, and public opinion formation. Her recent work examines the links between misinformation exposure and political trust, and she's one of the founders and principal investigators for the COVID States Project, which explored the social and political implications of the COVID-19 pandemic. So already, the second author indicates a political and social influence in this article. The third author is in political science, the fourth, political science, the fifth, political science, the sixth, political science, the seventh, government studies, the eighth, political science. It appears those involved in political science needed a physician at the helm to get published in the Journal of the American Medical Association, since no one is otherwise medical. To start, their question is, how did trust in physicians and hospitals change during the COVID-19 pandemic? So this is a very simplified question in a complex scenario that pretty much every adult is familiar with. The pandemic created a lot of fear, a lot of unknowns, and a lot of death. The vaccination campaign created a deep division between those who supported it, those who were against it, and many in the middle. Teasing out the trust in physicians and hospitals in that sounds pretty difficult. I would also say that having been a hospitalist during the pandemic, there's really two medical issues to consider here. First is trust related to the COVID-19 pandemic and the interventions that evolved throughout versus the management of every other disease. So when I read trust in physicians and hospitals during the COVID-19 pandemic, my first question is, well, are we talking about in managing COVID patients, or are we talking about managing everything else that patients come to the hospital for? Heart failure, cancer, not doing well at home, falling, hip fractures, whatever that may be. Trust is a very specific issue. A person could trust a doctor or a hospital system to manage their heart failure, yet have felt very differently about the COVID situation. There is no blanket trust here. Also, the trust in hospitals' ability to deliver care once you are already sick is a different problem than being involved in prevention strategies. So already I see that there's a lot of confounding issues here, and we haven't even gotten past the question. This group surveyed almost 450,000 respondents ages 18 and over who resided in the United States, starting in April 2020 to January 2024. The researchers note that trust in physicians and hospitals decreased substantially over that period, from 71% trusting to 40% about 4 years later. Individuals with lower trust levels were less likely to have been vaccinated or to have received boosters for COVID-19. All right, so we see here that they are talking about COVID. We're not talking about chronic diseases and all the usual reasons that people go into hospitals. So apparently they're looking purely at people's trust in doctors revolving around the COVID vaccine. Looking at the title, that specificity is not offered up front. They're just talking about trust in physicians and hospitals during the pandemic. But here, it's very clear we're talking about the vaccine. The authors state here, this study suggests that the COVID-19 pandemic has been associated with a continuing decrease in trust in physicians and hospitals. So what that tells us is that trust has been declining even before this. The pandemic accelerated it. I think that that trust has been declining because doctors can't reliably reverse or cure disease, not by necessarily any fault of their own, but because we simply don't possess the knowledge to do that. The COVID pandemic was no exception. Once people had the virus, we couldn't cure or treat it. It's also questionable whether the vaccine met the requisite expectation of what prevention meant. The authors go on to say that this may necessitate strategies to rebuild that trust to achieve public health priorities. Well, actually, restoring that trust is quite simple. All you need to do is understand disease. If a person expects an intervention to work and it works, you don't need to take any active role in restoring trust. It happens by nature of the intervention's ability to cure and protect patients. That we do not possess the knowledge to make that possible is the primary problem, not anything related to politics or social structures. Quote, trust in physicians and hospitals has been associated with achieving public health goals. This puts doctors at an interesting crossroads. Doctors generally are involved in taking care of individual patients and helping them get their medical needs met. That larger organization sees doctors as executing their public health goals is actually a different point of view. A lot of times doctors end up in the middle of that where there's a disagreement. They're trying to take care of patients, and yet there's these public health objectives that have a population focus. They do not necessarily agree and often don't. Doctors are known for having different opinions. When they look at research, they form opinions about what that research means and how they're going to deliver medicines. If patients don't like what they hear from one doctor, they ask another. For some reason, that only became a problem during COVID, where it was expected that every doctor did the same thing. But not every doctor does the same thing pretty much anywhere else. If you ask 10 doctors for an opinion, you're going to get 10 different opinions. Somehow, we saw that as a new problem during the COVID pandemic and the vaccination campaign. Nothing changed except the acuity and the fear that arose during that time. The pandemic really unmasked our inability to really cure or reverse disease. This study survey used non-probability internet surveys. What is non-probability? A sampling technique in which the researcher selects samples based on the subjective judgment of the researcher rather than random selection. Okay, we are not dealing with a scientific study here, just so you know. So the main outcome and measure was self-reported trust in physicians and hospitals, self-reported status of having received the influenza vaccination and booster status. And since influenza does not have boosters, I presume they're talking about the COVID booster. Then they used regression analysis to link sociodemographic features with trust and trust with health behaviors. So that's a lot of smoke and mirrors, I'm just gonna say it. There's nothing to actually connect here. These are all extremely subjective in nature. Then they go on to break this down into race and ethnicity and a lot of these socioeconomic categories that again illustrate the effect of COVID and puts a political slant on it, but it's completely missing the fear that COVID created for practically the whole world. Also worth mentioning is the researchers found that political association had nothing to do with trust, even though I don't think that political affiliation has anything to do with disease. We seem to forget that today. In the introduction, the researchers highlight the role of physician in public health outreach efforts. They say that appointments are an opportunity to encourage healthy behaviors ranging from diet and exercise to smoking cessation to seatbelt use and firearm safety. This is an overestimation of what physicians do and have time to do. Sometimes a physician will see a patient for 15 minutes a year or maybe up to 4 times a year. How often is that going to create meaningful behavior changes in people when they are not involved in that patient's life 99.9% of the time? They note an undercurrent of distrust in medicine, which is not new to U.S. society. For example, concerns about the health effects of vaccines have persisted long after they were disproven. Are we talking about all vaccines or ones in particular? The reference here is mercury vaccines and autism, but this is a very sweeping statement. Whatever side of the vaccination fence you fall on in general, what this indicates is a persistent fear that goes unaddressed, and we think that scientific knowledge directly combats fear, and it doesn't, or it doesn't always. That became prominent in the COVID-19 pandemic, where fear was unmitigated and scientists couldn't figure out why scientific evidence didn't reduce people's fear. Anyway, the pandemic was seen as a turning point in trust. I think that has something to do with the realization that maybe we aren't as smart as we think we are when it comes to disease in general. There's a lot to be said about the methods, statistical analysis, results, but in the interest of time and for the purpose of this video, I'm going to go straight to the limitations. The authors identify that they only considered trust about a single item, whereas trust is extremely complex, which is accurate. Trust is subjective, which makes it difficult to apply objective strategies to in terms of calculating statistics or determining what those statistics mean. Further limitation was lack of a true panel design. Here they state that non-probability sampling has been criticized for yielding less than representative samples, yet provide resources to indicate a high degree of concordance with the traditional criterion of standard methods. So they're trying to remove their own subjective nature from dealing with a subjective problem. And I would say that might have been one of their biggest downfalls. If you want to understand the subjective nature of trust and the impact on human societies, why would you try to do it from anything other than a subjective point of view? Again, the authors did not even mention or consider the effect of fear. At the root of that fear was a disease behavior that really nobody understood. Sure, we could follow the virus through populations and see what it did and how it affected people, but that didn't bring much comfort. People feared for their safety. They feared for their life, for their health. What about their loved ones? Were they going to spread it? Then when the rapid deployment of a vaccine came out, well, where's the data to show the long-term effects? How come people are still going in the hospital? That created a lot of uncertainty that scientific studies didn't necessarily reduce in terms of fear in a knowledge campaign. After all, emotions and experience have no role in science today, which I think is a really big problem. In conclusion, sorting out the trust issue during the pandemic is really dicey. There were so many elements at play there. While there were public campaigns pushing doctors and nurses out into the forefront, calling them heroes, it's interesting that on the back end now they are the ones that have had the biggest decrease in trust. What is the real reason for that? Is it because physicians were not unified during the COVID pandemic? Is it because politicians effectively overrode a physician's advice and the doctor-patient relationship in making an informed decision about how patients can make choices about their own bodies? Is it because the people who got the vaccine still got the virus even if it was less severe? But what we see again is the physician at the watershed of meeting individual patient needs and public health agendas which often don't align. It was a no-win situation because there was simply not agreement from the science, doctors, or patients, and there never would be. As long as we depend on a science that can't answer who will get sick when, and continue to deploy interventions that help some people sometimes, there will never be agreement. Only when we understand disease will the needs of patients and public health initiatives begin to align in a reasonable and feasible way. I hope you've enjoyed this talk. Please like, subscribe, and leave your comments below. See you soon.